I have family who had strokes, diabetes. Mom, she was on dialysis, and sisters had limbs cut off. And I said, hey, that's me right there. If I didn't try to improve some of the things that I always done. When I was in the 3rd grade, I had to get up in front of a crowd and say a poem. The name of my poem was Before It Is Too Late. And that's what I go by. I want to take care of myself before it is too late.
When we're talking about cardiovascular disease, the scale of the problem is quite large.
It remains the leading cause of death and disability worldwide, and certainly true for the United States.
I think when the challenge is so massive and the gap in care is so massive, the other way to look at that is that the opportunity is also massive.
We know that 80% of cardiovascular events and deaths are preventable if we modify risk factors.
We've known about the importance of risk factors for a long time, and it may seem kind of boring, but it is the single most important thing.
This recent article in the New England Journal looked at the long-term effects of the traditional risk factors that we all know about, things like hypertension, smoking, lipids, overweight, and of course, diabetes. Half of the global burden of cardiovascular disease can be attributed to these 5 major risk factors.
This paper used multiple different cohorts, over 2 million people, and saying, how can we translate what we already know into a different way to communicate what the benefits may be?
It gives us that lifetime risk perspective on how elevated risk factors can increase the risks for cardiovascular disease, specifically things like heart attacks and strokes. I think a key takeaway was that individuals who had all 5 of the risk factors at age 50 had roughly 3 times the lifetime risk of individuals who had none of the 5 risk factors that were elevated. That means that a man at age 50 with all 5 of these risk factors had a lifetime risk estimate of 38%, or a woman with all 5 had a lifetime risk of roughly 24%. Another key takeaway was the extension of lifespan, and in fact, it was quite dramatic. Women with 0 elevated risk factors at age 50 lived on average 14.5 years longer than the women with all 5 elevations in risk factors, and for men, it was about 11.5 years longer. This really makes a difference for our patients.
The paper did a really lovely analysis showing that if you could get people's blood pressure under control by midlife, and if you could get people to stop smoking by midlife, they lived much longer, healthier lives.
Hypertension and smoking are actually also triggers for acute cardiovascular events. If clinicians go full bore on smoking cessation or blood pressure control, they'll see a marked drop in cardiovascular event rates, and very quickly. About half of US adults have hypertension.
It is the single greatest contributor to cardiovascular disease, morbidity and mortality worldwide. And more than half the people with hypertension don't know that they have hypertension.
I used to drink beer at nighttime, maybe a case with my neighbor a week. And then I met Dr. Viola. I went to visit her one day and my blood pressure was up a little. She asked me, did I drink? I said, yes, ma'am. And she said, how many? I was telling her I was drinking 1 or 2. But I was telling a story. My blood pressure showed it. I ended up going back and being honest, and she told me to come to the high blood pressure class to learn how to be on the right track of making changes.
We seem to have missed the mark on getting people to be concerned when their blood pressure is persistently high. As a society, we just haven't been talking about it enough. One of the things that I feel like is really lacking is any structured education about hypertension. At our center, we started a hypertension education class to do everything we can to raise our community's awareness.
Before that class, I didn't really know too much about high blood pressure. I enjoy going to the class because I'm ready to learn a little bit more. I'm ready to see a little bit more.
We go over what is high blood pressure, how do you track it, signs of heart attack and stroke, kidney and vascular health.
There where you were 120/70, so that's our best day.
At our clinic, one of the things we've been working on really hard for the past 6 or 8 years is our hypertension numbers. Part of that is through our education programs and through our focus on it. We've included our medical assistants, our nurses, our providers, our front desk staff. Everybody knows this is something we're working on.
Health systems are not paid for prevention. You need somebody who is going to say, no, this is important, like Holly Biola. We're not being paid extra for all of this work, and yet it's the right thing to do for patients. There is a huge push in all of the cardiovascular societies, ACC, AHA, and the primary care societies towards focusing on prevention. The new blood pressure guidelines really focus on giving people some time to focus on diet and exercise, but if after a few months their blood pressure is not under control, don't wait. Start to think about treating them aggressively. We have long had risk prediction tools, and the newest iteration of the risk prediction tool is the Prevent Risk Calculator, both for atherosclerotic cardiovascular disease, overall cardiovascular disease, heart failure. It helps clinicians understand what the risk of the patient in front of them is in order to better tailor their preventive therapies and to understand how aggressive they need to be. The patients who have a high 10-year risk of developing atherosclerotic cardiovascular disease or heart failure and so forth, those are the patients you really have to focus on getting their risk factors under control. You really have to tailor your therapies. And then it forms kind of the basis for the guidelines for blood pressure management, for cholesterol management. A lot of that is based on what the individual's 10-year risk score is.
We know that if your blood pressure is over 140, over 90, you're gonna need at least 2 medications. But our general practice has been you start one, then you increase it, then you add another, and that has hindered the ability to more quickly control blood pressure.
You get the biggest bang for your buck from the initial starting dose of medication, and you only get very small marginal gains as you increase the dose. Combination medications synergize the different mechanisms of blood pressure lowering while also minimizing the side effects from any given drug. The drug classes that the evidence favors would be an angiotensin receptor blocker, an ACE inhibitor, calcium channel blocker, or a thiazide diuretic. One drug from the class of ACE or ARB, never use those together, combined with either a calcium channel blocker or a thiazide diuretic are going to give you the biggest reduction in blood pressure. If a patient requires a fourth drug class, I often will reach for an aldosterone inhibitor, something like spironolactone.
Spironolactone can also help treat patients with primary hyperaldosteronism.
You have to think about things like their potassium levels. They can be extremely effective as that sort of fourth line agent to help control blood pressure.
People who check their blood pressure at home tend to pay attention to it more. It really helps people to have that feedback.
First, I felt that I didn't have time to do it, but I started doing it, and it became fun. It became a habit.
He'll tell me, oh, I noticed that this happened because I ate sugar. He just has a really acute awareness of the way his environment and things he does affect his heart health. People often don't know what the numbers mean.
100 over 66.
Is that good?
At our clinic, we've got instructions for what to do based on what your blood pressure is. If it's in the red zone and you're having a headache, you need to go urgently to see someone about that. And if it's in the yellow zone and it stays in the yellow zone, you should make an appointment. We should see you within a month or so. And if it's light green, could you eat more vegetables? Could you get more exercise?
We know how to control blood pressure. It's just that it's hard to do. We know exactly what kind of diet helps. We know exactly what kind of exercise helps. We know exactly what kind of medications help. And so that means to me that if we can actually help people do it on a large scale, then we can bend the curve of cardiovascular disease.